Good morning, everyone, and welcome to our webinar, A Safer Return for Small Employers. You all should be prompted that the webinar is being recorded, so if you could consent to that, we'll be good to go. My name's Lily Tenney. I'm the Director of Outreach and Practice at the Center for Health, Work, and Environment. Our center is a center funded by the National Institute for Occupational Safety and Health. We're one of 6 national centers of excellence for total worker health. And this is our last installment of a COVID response for small business series that we've been conducting over the last year, in addition to really since March 2020, as an educational opportunity for organizations, for health and safety professionals, for HR professionals, and for individuals that are interested in learning about the most current guidance on the pandemic response related to worker health and safety. Our program HealthLinks has been working with organizations also for the past 18 months on COVID response. And we've heard from a lot of you that are learning and teaching us about what you're doing in practice. So today we have invited a speaker, John Doney, who I'll introduce in just a moment. I want to go through some housekeeping items. The first is that all participants will be kept on mute throughout the duration of the presentation. So if you have any questions, please enter those into the Q&A box. We'll have 15 minutes at the end of the presentation to have a facilitated conversation. So we encourage you to ask questions along the way. If you have any technical issues, please use the chat function. The webinar is being recorded, and at the end, you'll be prompted, please take a short survey, which is always very valuable to us. So thank you for your feedback. And you'll also be receiving, all attendees will be receiving an email with the recorded link and also follow-up resources. I'm pleased to introduce our guest speaker, John Doney. John is the Senior Director of Thought Leadership at the National Safety Council. In this capacity, he oversees the Campbell Institute, as well as Safe Actions for Employee Returns, or SAFER, which you'll learn about today, as well as Work to Zero, which is a program focused on serious injury and fatality prevention through technology. John also leads a variety of other research and impact initiatives, including programs related to psychological safety, ESG, and sustainability. Since joining the National Safety Council in 2007, John has led numerous high-impact programs, including the prestigious Robert W. Campbell Award. John is a frequent speaker at conferences in North America and Europe on topics including the future of work, emerging trends in EHS, management systems, leadership, and leading indicators. Prior to joining the council, John held quality management, project management, and coalition building positions in the communication and educational fields. So we're pleased to welcome you today, John. Thanks so much for joining us. I'll let you take it from here.
Thanks, Lily, and great to see everyone here on the call. Looking forward to presenting to y'all. Not a frequent speaker in Europe or America so much nowadays, mostly do those online, but looking forward to sharing with you today. All right, great. Well, I've got my screen sharing here, so hopefully everyone can see that. I'm going to talk to you all about, as Lily mentioned, a little bit about the SAFER program, what we've been doing on that front for COVID-19 response, some of the learnings we've found out of that work and the research we've been doing, and then sort of talk as well about the future world of work. And I'll try to keep this as relevant as I can to particularly to the small and medium-sized business front. We do work across the board with a number of different organizations of varying sizes. So we'll have something for everyone here today. Just a quick note on the agenda. So I'll give a very brief overview of the National Safety Council, who we are and what we're all about. And then I'll break things into sort of three different chunks here. The first being sort of the timeline of our response and what we've learned out of the SAFER work. The second chunk kind of being about the current state of response and where we are and what we're challenged by. And then the third being about the trends for the future world of work in the next normal. And then we'll have about 15 minutes at the end for Q&A. So that is the plan today. So a little bit about the National Safety Council. We're America's leading nonprofit safety advocate, as you can see here. We've been around since 1913, so 108 years now, and we have 16,000 member companies. The vast majority of those are small and medium-sized businesses. In fact, about 90% of them are small and medium-sized businesses, but we do work with other large organizations, Fortune 100 size, 1,000 size companies as well. You can see our mission here to eliminate the leading causes of preventable death and injury so that people can live their fullest lives. And we do that work where we can make the biggest impact. We follow the data and look at the trends. And historically, that's been in the workplace arena, but we do a great deal of work as well in roadway and transportation, as well as what we call impairment, which includes everything from the opioid epidemic to fatigue, stress, mental health, psychological safety type issues. And we have some great resources on that front as well. And then you can kind of see here on the left our tagline, which is to save lives from the workplace to any place. And certainly COVID-19 has impacted all of the arenas in which we do our work, significantly the workplace arena, but there have been impacts seen both in roadway and in impairment in terms of the long tail of opioid misuse and other issues related to stress and mental health that we're all very familiar with. So I'll talk a little bit across the spectrum of that today, perhaps maybe not as much about the roadway side of things, but more so on the workplace and impairment sides. So just starting off with what I'll call phase one, from crisis to recovery. It seems like every time I'm giving a presentation here, I end up adding a new box to this chart, and the timeline grows, which at some point we'll get to stop using this. I know we're all eager for that day, but we've been doing this work as Lily has, and the work she's been doing really since March, when we launched our coronavirus hub, and we were sort of reactive at that stage in time, as I imagine a lot of organizations were. On this call, we were piecing together things from different sources: CDC, NIOSH data, the Hopkins resources. But it really turned the corner when we launched what we call our SAFER Task Force, and I'll talk a little bit more about that in a minute. But that was the group that we pulled together to really consolidate some of this work. And then from there, we've done a variety of work, including a kind of a big template document called the SAFER Framework, which is about a 30 to 40 page document that lays out actions across a variety of different spectra for organizations to take action on related to COVID-19 response. We've drilled down into different resources, different playbooks, different cuts of that data or information. We published a variety of research papers, which I'll cover a little bit of today. And then more recently, we've been working in lockstep with CDC and NIOSH on a cooperative agreement, particularly centered around long-term response to infectious disease, COVID-19, vaccine uptake, and sort of what the next steps in that whole arena look like. So as we came into this year, we were doing a lot of work on vaccine support, and now really looking at ongoing guidance related to vaccines, related to masks, related to how people are returning to work and what that's going to look like, or how they're expanding operations for those who have been at work this entire time. And we know that's a significant segment of the population. So a little bit about SAFER in general, as Lily mentioned, it's an acronym for Safe Actions for Employee Returns, but really we look across the worker spectrum. So it's not just employees, but workers of all types. And it's really an effort that sets around helping organizations grapple with both in the early days of the pandemic and now, understanding how to safely resume traditional work operations, both now and in the future. You can see some of our objectives here: to gather expertise, develop data-driven guidance, release tools and solutions, share best practices, and really at the end of the day, help organizations continue to do work in an effective and safe way. And that's the kind of core objective of the work here. You can see some of our sponsor organizations who have helped us out along the way here as well. This is a list of the members of the task force. So it's a bit of an eye chart, and I definitely acknowledge that, but I share it to show that a lot of what I'm going to talk about today is coming from the collective guidance and wisdom and work of many of these organizations here. So you see corporate entities, you see nonprofit entities, government agencies, trade associations, other nonprofits. So really across the board, a great effort from across different stakeholder groups that engage in all of this work. And that's been exciting. We've had a chance to work with organizations that we didn't touch as much in the past, like the World Economic Forum, for instance, or the Business Roundtable. Chances to really get deep with some of the work that they were doing. So it's been an exciting, as much as there's been many obvious negatives to COVID-19. One of the things that we've seen is there's a great appetite for and desire to engage really meaningfully in these sorts of partnerships and efforts. So that's been exciting to see, and everyone's pitched in really well on these sorts of efforts. You can see here the main web page or landing page for SAFER. We have a variety of free guidance, resources, and tools up there. We update that at least once a week. Typically, that's on Thursdays. That cadence is now really whenever we have something new to share, and that has been roughly weekly, even if it's just small updates to existing resources that we've put together. You can see what the landing page there looks like. There's some pages that are broken down into different categories of types of resources we have available and other things you can go grab. So very, very resource rich site with lots of great information on it that I would encourage you to go take a look at. I mentioned the SAFER framework, and I'll just kind of reiterate that here. This was the foundational document that we've put together and updated as recently as about a week and a half ago on the 6 key components for a safer return to work. And those include, of course, the things that you would expect from the physical and sort of medical dimensions of response. Understanding how to change and make interventions within your facilities or your work sites or work environments, as well as understanding the medical dimensions of the disease itself and the biovectors and things of that nature and how that all plays out. But we've also, from the beginning of this whole conversation, really talked a lot about the other pillars of this response that were underserved, especially in the early days. And those included stress, emotional, and mental health concerns, the way that this impacts the employment, legal, and HR environment, the critical importance of communication and transparency in response efforts, and then external factors that organizations and individuals don't have direct control over. That includes community transmission rate. It includes legislative environments or enforcement environments. Things that are out there in terms of how government agencies, both local, federal, and state, are responding to COVID-19. We broke that up across, you'll see on the left here, 4 different types of operating environments. We didn't do a deep dive for each one of each industry sector, different codes or levels of detail there. We did group environments based on risk profile, such as office, closed industrial, which would be sort of manufacturing, open industrial, which might be construction or field work, and then public, which would be things like retail, hospitality, things of that nature. And we provided cross-topic guidance that were bounded by level of exposure and phase, and acknowledge that even within all of these dimensions, not every day or week or month of the viral arc here for us over the past year has been the same, and not every group of workers or work site is created equal from that front in terms of exposure and where we all are. So each of these different dimensions, the 4 types and the 6 elements, all have their own sort of playbooks or frameworks that we spun off that you can go grab if you're maybe only interested or maybe more interested in one of these as opposed to the others. So that's all available for you as well. I did mention the phasing piece, so we did break down a template like this that helped organizations understand how they needed to take action across various dimensions of the framework by these different phases that we're in. And I'm, really happy to say that I think, now we've probably crossed the line, certainly into phase 2 at this stage, and hopefully headed toward phase 3. I know every state and every municipality has their own, red, yellow, green charts on this. This is the one we created early on that's a sort of macro look at all of those. And then sort of helped organizations break that down. Acknowledge that any individual place you work or point in time, you can go back, not just forward. So we've certainly seen that and are seeing that now in different parts of the world as well. But this is another helpful framing tool that we created early on. We also, I mentioned a lot of the resources and tools we have available. We have dozens of different documents like this, which include different sort of cuts on issues, whether it's, if you need help on determining, what to do when there's a confirmed case in your workforce, a deeper dive on stress issues, a risk exposure kind of tool or assessment. These are all things that you can go and grab at the site, and they continue to be relevant for us now. I think they'll also continue to be relevant in the future as we learn to plan for, hopefully the not the next one of these, but something like this. And these sorts of tools and guidance documents are going to be really beneficial in future planning, as well as the immediate response to COVID-19. One of the best tools and greatest things we put together, in my opinion, was something called the Organizational Vulnerability Assessment. And this is already out there and available for you to use. It's still out there and going strong. We've had hundreds of organizations complete this. It's really a demographic and risk assessment tool that you can use to understand your vulnerability to COVID-19 and more broadly to infectious disease and emergency type situations. It is a fairly lengthy assessment. It takes about a half hour if you complete all of it. But it gives you a vulnerability score. It gives you a list of control measures that you can put in place, and a summary document that you can use to kind of form a task list or an action plan. So we continue to update that as well, and we will have plans going forward to generalize that out from COVID-19 into other sorts of areas going forward as well. So great free tool that lives on the website, and you can go ahead and engage with. Sort of on the research front, from the tools and resources side to maybe more the research side, we spent a lot of time in the spring, summer, and fall of last year doing research on both the state and employer response to COVID-19. So what you're seeing here is a snapshot from our state response report, which came out in June of 2020. So now, nearly a year old, which is hard to believe, but really looked at some of the things that were going on at a state level at the time in terms of response. And this wasn't, this was tailored to workplace level response and how well states were doing in providing access and guidance to employers, to workers, and taking into account those unique challenges. So that report's available as sort of an after action summary that folks can take a look at. And it provided about 20 recommendations on how states can better tailor their COVID-19 response for the employer community and worker community. We also did an organizational level look, and this came out in August of 2020, and looked at how much organizations, amongst other things, looked at what organizations were doing, how much they were spending on COVID-19, and what was perceived to be most or least effective. So some of the findings here, and I have a whole slide deck I could share with you on this one too, but some of the key findings at that point in time were that organizations had already spent at that point over $5,000 per employee on various safety practices, and that includes everything from overtime pay or hazard pay to PPE to engineering controls that were put in place to other sorts of factors that might influence or be perceived as a safety spend. And then a look at what total organization spend was at that time. Obviously, this has increased significantly in the time since. We're planning on doing a resurvey on many of these questions in the near future for release in September of this year. So more to come on this front as to how this has played out over the course of the entire arc of the pandemic. And then the third big research report that we put out, which was in December of 2020, was the initial look at the future world of work and the kind of the state of where things were going in the immediate post-COVID world or at the tail end of COVID world. And when you ask the question of what changed, the answer was essentially everything. Everything from operations to communications to sustainability. So we began to conceptualize what we were looking at for a new state of work, even at that point. And I'll talk a little bit more about that on the back end of the presentation, as that's kind of the focus of the back half here. So those were some of the early. I think that takes us up to the end of the calendar year, essentially, in terms of where we were and what we put together. I want to maybe turn now, as we've got a little bit of grounding in where we've been, to sort of where I think we are, and what I'm terming, from recovery to resilience, and what our current state and challenges are. So we're really tracking, I'd say 5 major buckets of issues or current state challenges that we're looking at. One is testing and tracing protocols. Another is vaccine education and uptake, mask and PPE usage. work environment interventions or changes that you've made in your actual facility or work site, and then mental health, stress, and psychosocial issues. So I have a slide on each of these. I do have the vaccine piece highlighted in green here because we do have a much deeper well of resources to share on that front. So I have a few extra slides in there that show some of the particular resources we put together on that front, where you can hopefully gain some additional value on that. But I'll take through these. There's certainly more things that we're tracking and engaging in, but these are 5 of the ones that are currently taking up a lot of airtime and we're getting a lot of questions and comments on. So from a testing and tracing perspective, I think we know that testing is certainly more widespread and tracing efforts are more feasible now that we're in the current containment arc that we're in with COVID-19. But want to just kind of call out here that this is something that we're really encouraging employers to continue to do, particularly from a beyond the health screening and temperature screening perspective. We know that's commonplace. We also know it's not necessarily the most effective, mechanism for actually preventing COVID-19 infection. It's better than nothing, certainly, but it's just a starting point. And now that testing availability is much higher, the ability to do regular or asymptomatic testing, do at-home and antibody testing for your workforce is much more feasible and much less expensive nowadays. So we definitely encourage organizations to do this, and we see a lot of orgs that are picking up on this. There's a partner of ours that we've engaged with that actually will help you sort of do a testing solution in a box sort of approach, where they'll pull up their bus and get you all sorted there on site if that's something you're interested in. So we can connect you to great organizations that can help with things like that. But really, I think that the challenge here is now we're really trying to prevent those micro kind of cluster, what I call the nth wave infections. If we're at wave 3 or 4 now, we certainly don't want to see a wave 4 or 5 or 6. And we'll certainly continue to see those pockets and clusters, but continuing to be robust on testing and tracing is something that we're seeing a lot of employers engage with right now. I mentioned I have a little bit more depth on vaccine education and uptake. This has been a huge area of focus for us over the past 6 months now. And we know that employers are actually considered the single most trustworthy source of information for the employed population. There's been lots of studies on that, as opposed to government or other sorts of organizations. So, we think employers need to focus on these 4 issues: providing accurate and scientific information, engaging in transparent communication, listening and engaging their communities, and of course understanding the legal and privacy limitations, which are changing in some cases by the day. So I can talk a little bit about that in a moment. I'll just point you here toward our vaccine resources. There's another link that we'll share out after this that's more direct. You can get here from the Safer landing page, but there's also a direct link to this page, which helps you grab education, guidance, and also look at the future world of work, which I'll share. Within that, we've got 6 or 7 or 10 good documents here. I'll just do a quick sampling of them for you. We've got a document where you can chart the elements of your vaccine strategy and go into here and look at all of these different issues that your strategy should be conversant with. And hopefully many of you have already done this, but this is a helpful check against, where you may want to go deeper if you haven't already. So just wanted to share that this is out there and available for you, alongside sort of a companion doc, which is an FAQ, more so of questions you need to answer, not so much questions we're able to answer for you, but ones that you can go and engage with and make sure that your policies or procedures, have answered these, or if they haven't, you understand your plan to answer questions that may arise on these sorts of questions. Everywhere from your requirements to how would disruptions change your plan, what policies need to be updated, etc. From there, we've also produced a little bit of guidance or research on how employers are responding to vaccination efforts, and a lot of this has been ongoing as we've gone. And that the mention I made earlier of updates coming by the day, over the holiday weekend here, we had the EEOC release some updated guidance on incentivization and mandate of vaccines. And those statements were essentially that clarifying that employers can can choose to mandate if they take the right right approach to exceptions and exemptions from vaccination, as well as increased encouragement toward incentivization. We're seeing a fair bit of hesitance around incentivization of the vaccine early on, particularly because of potential discrimination challenges. If you offer direct cash incentives to employees, for instance, that could be perceived as discriminating against those who are religiously or medically not able to take the vaccine, or who otherwise don't want to. So the EEOC had clarified just recently that as long as the incentive isn't coercive, then they can be offered. The jury's out on what coercive means, and I am by no means an employment or labor law practitioner, so I can't really provide a whole lot of guidance there. But I can say that the veil has been lifted on that a little bit more so. And while earlier we were seeing more employers stay on the side of encouraging uptake and increasing ease of access, paid time off for those who did choose to take the vaccine to do so. Now we may be seeing that tip a little bit more towards incentivization as we hit our next level here. And then a couple of the more recent documents we've put together. One is a considerations document for reopening, making sure you're looking at all of these dimensions, the way work is done and how performance is tracked, environment of the work being done, and external community related issues. So not just reopening in a way or expanding operations in a way that fits the desire of leadership, but taking into account effectiveness of work, preferences, work-life balance, and all of those aspects as well. And then we did put out an infographic and a workplace guide to the vaccine conversation, which are some great tools for you to actually go in sort of practically with in your organization and utilize. So some great stuff that's out there for that. So moving on from the vaccine, and I'm happy to spend an hour talking about the vaccine, but in the interest of time, just wanted to make sure that we hit some of these other issues. One is we've obviously seen the guidance from CDC on mask usage change, and we also saw some changes from OSHA, coming in the wind there as well. So we know that this was a whole different story early on when it was more about scarcity and potential counterfeit items. Now it's really more about go forward usage, and employers are in this gray zone of not really having the best guidance at this point on what to do, and in some cases it may contradict existing guidance about differentiation between people with vaccinated populations and non-vaccinated populations. So we're monitoring this one closely. We work directly with OSHA and CDC on some of these, and as I was hoping I'd have a little bit more information to share with you today. Know that there is workplace guidance coming from NIOSH and from CDC in the very near future, as I understand it. So hopefully may see that this week for all we're aware. So stay tuned for that. On the work environment side, a lot of the question now is on efficacy. We've all variously put things in place over the past 16 months as we've reached this point of the pandemic. Everything from plexiglass to signage to maybe sometimes direct engineering controls or controls on how the work is done, work design issues. So sometimes big costs involved here. Not sure what the return on investment is. The question is really now, are we proofing? Are we now proofing, or are we future proofing? Are these things we want to have in place for the long game? Are they here to stay, or are these things that are going to start to trickle out? And I've seen varieties of that in different work environments, and I think to some degree it depends on the risk exposure within the environment. But it does seem certain things that are common sense and that help with just general infectious disease control, such as plexiglass in retail environments. Those sorts of things may be here to stay, and there's no direct cost in keeping them, in the workplace. Whereas redesign of work that maybe led to efficiency changes, may be desired that those go away sooner rather than later. But it is a challenge to determine efficacy. These are questions that require a lot of in-field testing and determination, and in-field testing is not something we've had the luxury to do a whole lot of over the past year. So we're going to continue to monitor this and help organizations understand which of these interventions are effective, which are not as effective, and how they can grapple with changes going forward. And then, we've all heard a great deal about mental health, stress, fatigue, other issues over the course of the pandemic. I think in general, many organizations, I suspect, were less mature in this area than they wanted to be at the outset of this. I think we've built that muscle a little bit over the past year. And I really hope that we continue to strengthen that muscle. And so that's kind of what we're tracking, and what we're challenged by now is, we know that there's this long game here, this mid game that we're in, where the challenge shifts more from, the isolation or the grappling with a remote environment to grappling with the return, and recognizing the relationship to things like fatigue, stress, impairment, coping mechanisms that might not be the most healthy, and in some cases it can have direct safety impact. So, we also know that there's a difference here between, what I'll call knowledge workers and essential workers. I've had the luxury and the privilege to be in my home office, and although that's had challenges, certainly, over the year, I think it pales in comparison to those who have been on the front line of the pandemic, putting themselves in harm's way every day from an exposure perspective. And I think as we reopen or we reintegrate these workforces, there'll be some just cultural challenges, and we've already heard that's an issue emerging, where there's resentment, there's just the coming back into the culture and becoming one family again is going to be, I think, in some ways harder than it looks. So tying this to mental health, certainly, because there's a relationship there, but it's maybe even broader than that, and gets into sort of sociocultural issues that we're having to deal with as a nation on the backside of this pandemic. So lots that we're continuing to track there. So again, in the interest of time, I've got about 15 minutes left to present to you, and then want to hold that last 15 for Q&A. So I'll go quickly through what I'm calling the 8 trends for the future world of work. And this is something that we put forward actually in December of 2020 and have grown on since then. But we'd spent a lot of time over that past year researching, surveying, talking to safety and health, HR, operations leaders. And as I looked at all of that compiled information that we pulled together, this sort of structure really sort of came to me as I looked at how we organized what the future of world of work was going to look like. And, I've sort of chunked it out into the ways we do work, which are the work modalities. That includes remote work and flex schedules and things like that. The expectations of the workforce, and I've talked a little bit about that already: communication, stress and mental health, the benefits that have been already given to folks and it'll be difficult to remove. And then the things that help us do work well: safety and health, cross-functional teams, technology, all those sorts of things. And that led to these 8 trends, which I will go into for you all. I'm just going to touch on these briefly. Again, could spend a whole hour, and I'm happy to follow up with anyone who has deeper questions on these after the fact. But we'll cover the 8 trends in brief here for you right now. So the first trend is lean, distributed, and asynchronous work teams. Those teams we've been working with, to some degree over the last year. Multidisciplinary folks who maybe weren't doing something, and now in this COVID world have been doing something because we had arms and legs and a need. So that's been the change to the way we've been doing work. And just, to reiterate or to back this up a little bit, as we think about how that plays out in our return to the office, many of you may have seen this data point done by an organization called Robert Half, that 1 in 3 people currently working from home would actually look for a new job if required to return full time to the office. So there's just a tremendous, as much as there's a benefit from returning to the office, we know there's tremendous challenges and resistance to the way we do that. And I think that those teams that we'll be building in this near-term sort of hybrid environment will probably look quite different than the ones we had either before the pandemic or maybe in the long term as this all settles. And it's going to be a kind of a tumultuous next 6 to 12 months as we work through all of that. Another thing we've seen certainly alongside that is that there's a great need for new skills and modes of leadership. As leaders ourselves, we've probably been challenged by the ability to effectively work remotely and engage our teams the way we typically like to engage them. We've also seen, in the long term, outside of this, that trend toward a more millennial and Gen X oriented workforce, entering some of the more senior roles in organizations. And that's brought with it new skills, new modes of leadership, new ways of interacting with people. So it's that demographic change alongside the acceleration of the pandemic has really brought us to some need to do things differently. I'll say that, as with other trends, probably all these trends, in fact, COVID-19 hasn't been the reason for these trends. It's been more of an accelerant or fuel for these trends. These were things that were here prior to COVID, but COVID has really just breathed some air into and really, really fueled to grow quickly. And this is one of the ones where I think that's most obvious and most visible. One thing I'll share on this front is, as we think about the hybrid work environment, as we think about, new leadership styles and the way we're going to engage in work in the next 6 to 12 months, it struck me that we spent a lot of time as safety and health professionals talking about habit prior to this, when it came to forming a good culture, to sort of ingraining in ourselves and in our workforce the way we do work safely. And a lot of folks used to lean on this book that you see here, The Power of Habit, which is by Charles Duhigg. And he posited, after a great deal of research, that it takes about 90 days on average to form a habit. Well, we've been forming the hybrid habit, or whatever habits we've been forming, if we're essential workers or not, over the past 360, now probably closer to 500 days. So there's a lot of ingrained habits that we now have, and those are things that, as we work toward our new leadership styles, we're going to have to reckon with. We also know there's this sort of post-vaccine inertia. I think maybe some of us have experienced, and maybe this week in the U.S. this weekend was one of the first where we sort of started to take take the shackles off of that a little bit, which was, it still felt a little strange to go out and do some of the things we know it's maybe okay to do now, whether in our personal lives or in a work environment. And that inertia of, just it still feeling culturally inappropriate or socially inappropriate is a very real thing. And I think maybe this Memorial Day was the first time where things were sort of starting to feel a little bit more normal, at least for the time being. And the other thing I think, to mention here that's very real in the new sort of styles of leadership and modes in which we work, is that there's going to be a lot of confusion. There's going to be a lot of, there's a lot of trauma and stress that we've put on ourselves, both as safety and health and HR leaders and operations leaders, and just as workers and people. And I think that as we roll into our new leadership styles and new approaches, acknowledging that and validating that and working through it is going to be really important. It's not something that we can just sweep under the rug and pretend never happened. So certainly something that is a takeaway for us going forward. This is maybe not as directly related to this audience in particular, but something that I do think is important, and that safety and health has an increasing role in, which is sustainability and environmental, social, and governance activities. So certainly there's been some direct changes to this over the pandemic. We probably all saw some studies or news reports about the global greenhouse gas emission footprint and carbon emission footprint has really shifted in the early days of the pandemic, particularly during the significant lockdowns. And now in the longer game, with lower building occupancy and less commuting, that may be something that's here to stay for a bit. But in the broader context, I think there's a big relationship here to ESG and environmental, social, and governance, something that has seen an increased focus from the investment community, from boards, from folks who are just out there in the public. And I include up here a quote from Larry Fink, who's the CEO of the single largest investment and asset management firm in the country, BlackRock, which has nearly $9 trillion of assets under management. About 2 years ago now, he wrote this letter speaking to his employees and to the public around how companies must now benefit all of their stakeholders, including shareholders, employees, customers, and the communities in which they operate. So essentially validating the premise behind sustainability efforts and ESG. And I think as organizations come back off of this time we've been in, the importance of safety and health and human capital, so to speak, has become much more obvious and significant to them in a very real way as a result of pandemic. So I think there's an increasing role for safety and health to play in this conversation, and that's something we'll certainly be tracking going forward. Another trend that we've seen really kind of come to the fore is a dramatic increase in transparency, constant communication, surveys, pulse surveys, cultural surveys, understanding we're all working, the way we're working, warts and all. We're all looking at each other's home every day at this point, right? There's also been this concurrent, focus on social justice and diversity, especially in the U.S. for very obvious reasons. And we see a lot of organizations, compelled to speak up on issues like these at a macro level. When we take it down to kind of a workforce level, I think this is really where the concept of psychological safety comes into play, and thinking about building our go forward work environments in a psychologically safe way, not just a physically safe way. Our CEO has sort of coined the phrase that you need to feel safe to be safe. And I think that's a great way to put it. And psychological safety is all about the ability to feel comfortable making mistakes or admitting mistakes, owning up to what you've done, learning from failure, and sharing openly. And this is, in a safety context, maybe most or best exemplified by the NASA culture. I think they learned a lot out of the two major incidents that they had. And one of the things they saw was they didn't have a devil's advocate kind of culture, and people weren't comfortable pointing things out or making mistakes or suggesting that maybe there'd been something missed. And so we're continuing to do a lot of work into how you operationalize this concept, because it's I think everyone can kind of understand it conceptually. It's a lot harder to take it and build it into your work culture. So that's something we're going to be continuing to track and do over the course of the next couple months and years. One that's very obvious to me and hopefully to all of you is that we see safety and health as embedded in the core of the future world of work. And we've long held that this is something that we believe in, and that safety and productivity are complementary. There's been a really very real object lesson in that in the past year and a half. And organizations now know that they can and will succeed by leading with safety and health. And I looked at some studies on this, and this is from MIT's Sloan Culture 500, which is a group that of businesses they pull together and study regularly that are known as having strong organizational cultures. And you can see here highlighted in red, the employee welfare category, which includes health and safety as well as mental well-being. For the top 50 companies during COVID-19, those were huge drivers of their success. 36% saying that was a positive thing for them for the top 50% top 50 companies in that cluster. And then those that did the worst or were mentioned more negatively from a culture perspective, again 18% of respondents highlighted health and safety as a big reason there, as well as family-friendly policies, which I think fits into the mental health dimension of safety and health. So you look at this as one of the single biggest either positive or negative drivers in determining whether your organization is succeeding culturally is employee welfare, or as we would call it, safety and health. So just some really good significance there that's going to be important for the future. Another thing that I don't have on this deck, but I've pulled separately, is that actually safety and health professional hiring is up hundreds of percentage points over this time last year. And when organizations were asked what kind of roles they'd be hiring for in the immediate future, even very recently, safety and health professionals were still right up there. And it's not been often in my experience that we're seen as hot hires in the working world. So really exciting to see organizations embrace that mechanically. Another trend here, and I think this is one that's very near and dear to Lily's heart, certainly, is what I'm calling here the whole person valuation. She may also hear referred to as total worker health, and really looking at the whole spectrum of physical and mental well-being, as well as physical safety in and of itself. So really valuing the whole person from all aspects. I've already talked a fair bit about mental health, so I won't belabor that point too much here. But I will say NSC's recently released a mental health cost calculator, as well as the existing employer cost calculator for substance use that is on here that sort of is related to that you can go grab. And then we can see here from these charts that this is certainly a long game issue, right? We know that even as of January 2021, according to the Kaiser Family Foundation, 41% of adults on average were reporting symptoms of anxiety or depression disorder, as compared to only about 11% prior to the pandemic. So just a huge increase in that. And that's not something that is like flipping a light switch. It doesn't start right away, and it doesn't go away right away. So just a huge long tail issue for us to deal with and grapple with. Two more quick hits on trends here. One is technology as a mandate. We saw certainly organizations focused on technology pre-COVID, but now no one wants to be behind the curve when there's the next disruptor like COVID-19. And you can see here some studies that have proven out that those, and these are from McKinsey, essentially the short takeaway here being that during the crisis, the organizations that were most well positioned to do early adoption of technology, whether that was Zoom or something else, were those that actually did well and responded effectively. So, certainly just in a preparatory sense, being ready and being eager to early adopt here is a huge factor in success. And NSC has an entire program on safety technology and health technology called Work to Zero. So feel free to dig into that. We have some great free research and reports and tools available for you to look at in terms of how you can effectively implement some of these technologies in your workforce. So lots of great resources available through Work to Zero. And then a final one I'll just hit on really quickly is internal and external partnerships. So, with all the shifts in work patterns that we've seen, we've also seen new doors open, and what I'm calling kind of an egoless mindset. Folks are much more willing, it seems right now, to just roll up their sleeves and get things done. And that kind of radical collaboration, working with folks whom you maybe never worked with before, or someone on the other side of the world, or someone who you didn't get along with before, and maybe now you do. That's really been a great thing, both inside our organizations and just kind of an external partnership perspective. We saw things like the N95 collaborative that sourced PPE for folks in an open source way. We've seen testing commons spring up. So lots of great big picture things. But then when it also just comes to internal collaboration, you can see here that, roughly, 80% almost of over 80% of folks surveyed on this topic of collaboration, we're seeing either the same or more collaboration than they were in pre-COVID times. And sometimes that's a double-edged sword, to be sure. You can see that there's about a quarter of people thought they were overloaded by the amount of time they're collaborating with others. But this is something that I think is here to stay. When you find something that's effective, you don't get rid of it just because the situation changes. So I think we're going to see a continued collaborative approach in our organizations, and figuring out how to not overload folks is going to be really important going forward. So that's a very quick look at our 8 trends and some of the work we've been doing over the past year. So I'll pause there, and I think we've got right on about 15 minutes for Q&A. So hopefully did my job well there, and I'll toss it over to Lily to help us through that.
Thank you so much, John. Those were really great insights, and yes, you nailed the time. So we have questions coming in, and I wanted to start by asking you specifically what you've seen some of the smaller employers, those that have just been struggling through the shutdown to survive, to operate, and then when things started to reopen and they were bringing people back, and maybe we're talking about organizations that have been operating throughout. What are some of the biggest occupational safety and health challenges that you've seen small employers addressing?
Yeah, absolutely. So it's a great question, and it's one that's kind of stuck with us this entire time. I saw, as probably everyone else did, and then some of you may have experienced directly, the kind of conflict that would come between, local kind of mandates as to when businesses can be reopened, partially reopened, et cetera, versus a very significant reality of, if you don't open or don't do this, you're simply going to go out of business. So the lack of resources and bandwidth to grapple with some of these interventions or doing some of these things that are luxuries for large, maybe perceived as luxuries that larger organizations could do, and triaging what's actually most effective has been one of the single biggest things. You've got your laundry list of all these things you can do, and we've certainly helped organizations think through that. But where can we drill down on the necessary things that we're going to need to do to really, get the biggest squeeze for our dollar, for our time and effort. I think now the challenge is that we're in this kind of gray zone in between. Things are moving very quickly, and the resources for small employers are still kind of being left behind. There's not, it's easy for a big organization to say, okay, we're going to go throw our weight around and say, we're going to mandate X, Y, or Z, or we're going to do, A or B policy because, we think it's the right thing to do. And it's going to be harder to challenge us when we're a big kind of monolithic entity. When you're a smaller organization, you don't really have that luxury. So I think, it's more of a policy level thing at this point that are the challenges. It was at one point sort of an engineering and control challenge, and now it's more about how do we grapple with policy. So, NSC is going to continue to try to really engage that's the small and medium employer community and help you think through these things. I think what we could really be helped by is hearing from you what your challenges are day to day and engaging in this work with us. And the more we do that, the more we'll be able to provide things for you on that level that will be useful. In the meantime, we'll continue to translate the things we see from the bigger organizations and hopefully bring them down to a practical level that'll be easier to implement and sort through for small and medium-sized companies.
Thank you. And I loved how you summarized all of that as far as what we're learning in the 8 trends. And one of the things that you've hit on that's connected to so many other issues is a question that just came in, and that's related to the family-friendly culture that the pandemic has really elevated and revealed as not only a second job that a lot of employees have, and responsibility or duties, however an individual perceives it, but how workplaces, how employers have been accommodating this, and how do you think that will shift the caregivers in the workplace moving forward?
Yeah, it's a great question, and I love the way it's worded in the chat around it's a secret second job, whether that's caregiving for children or whether that's caregiving for elderly parents or grandparents. A lot of us are stuck in that bind of having to work 2 or 3 hidden jobs. And so I do think it's a trend toward the future that employers will have to be more cognizant of this and more deliberate with their approach to it. And again, I think this was coming even before COVID, but COVID has magnified. You look at the millennial demographic, and they tend to stay per surveys and research in a role for about 3 years. And if they're not getting what they need, both from a job satisfaction perspective, as well as just an employer's sort of ethical stance perspective, they will move on. And a big part of that has been flexible work arrangements, work-life balance, consideration of those sorts of issues. So I think that to stay competitive, employers are going to have to acknowledge that, whether they would want to or not. In a very practical way, a way that safety and health professionals and leaders can help deal with that is really simply by bringing that level of transparency to their teams and not overstepping or asking folks to disclose information that they're uncomfortable or that would be legally problematic to disclose. But one thing that I've leaned on really heavily over the past year is just being really open and honest with my team about what I'm going through on that front, what I have coming at me this week, and letting them know it's safe for them to tell me what's coming at them this week. And if they need to, do their work in a way that's unorthodox, if I'm getting emails from them at 11 p.m. because that's the time that they've chosen to do work, I don't want to encourage them doing work at 11 p.m. But I also want to say, if that's the way you need to get things done, you go ahead and do that, or vice versa. If you need the week off, and we'll deal with it. So I think it's about personal level approaches as well as organizational level approaches. HR policies are only going to ever be able to go so far, generally speaking, on things like that. And it's going to be up to supervisors and leaders to really take that culture and run with it and make it real for folks.
I agree. And I think that that's what we're seeing with a lot of the organizations that we're working with, even our own, is operationalizing that really requires a level of flexibility that isn't just even at the unit level, but is that personal one-on-one between supervisor and employee to talk about what those individual caregiving needs are. So I think we'll continue to see how that plays out, and also what it means as far as those that need to show up from 8 to 5 every day, and those that are in positions that are more flexible as far as equity, social justice goes.
Absolutely.
So another question regarding HR is about those organizations that have have actually identified this as an opportunity to have employees stay fully remote. So the question is if a company is currently 100% remote and looking towards more of a hybrid model for depending on departments, roles, positions, what do you think will be the biggest challenge that HR should focus on?
Yeah, it's a great question, and it's one that NSC is going through right now as we speak, because we have largely been in a situation where we've been fully remote, and we're transitioning to trying to meet employees where they are and workers where they are. And I think that's the biggest challenge, is I think allowing for the right degree of flexibility. And we've seen organizations struggle with. You may have a leadership team that is a very strong believer in the value of sort of managing by walking around and wanting to make sure they have hands-on with their workforce, and that's how they build culture. And there's nothing wrong with that necessarily. It's just that not everyone is at that same place. And certainly I think over the past year, a lot of folks who maybe were in that direction have now seen some benefit or value out of being remote, and what that's meant for them in terms of, being able to do caregiving, for instance, or just simply having the extra energy that comes with not having to do a 2-hour commute every day. So I think the biggest hurdle to navigate is how to effectively meet that diverse population where it is. You'll have those folks who are gung-ho on either side. Hey, I still want to be fully remote. Hey, I really want to come back to being in the office 5 days a week. And then there's probably 70% of the workforce that's in the middle somewhere, and finding the way to effectively navigate, what can we allow for hybrid? What do we think we need from a cultural perspective versus what's nice to have? And then, rolling with the punch of what you get back from your team, because you're probably not going to get back what you expect. And if I look at the teams that I lead, I've got across the board folks who want to be remote the entire time and folks who are really ready to get back. And so, being flexible at an organizational policy level, and then figuring out how you don't create more challenge from it. Having folks come in the office just to do Zoom meetings all day, probably not a really effective working environment. So we're going to have to acknowledge that we don't know everything. We don't know at this point, and that some of it is we're going to be working through. I think flexibility is the key at this stage.
It's definitely the hottest term out there. Mm-hmm. Well, John, I want to wrap up with and put you on the spot with a hard question. So as we continue our path to return to normal, what do you feel out of your 8 trends, out of lessons learned over the past 18 months, is the most important thing for small employers or all employers to consider making as a return to better for occupational safety and health?
Wow, that is a really tough question. I want to say all of them, but I will say, although you might expect me to say safety and health at the core, I think that's something we've learned and we can embrace. I don't think we need to double down on that as much as I would, at least I hope. I would say that the one that actually maybe underlies or impacts a lot of these and is an amplifying effect is the transparency and communication component. Because when whether you're trying to return to a culture that you once had that was great, or you're trying to build back better, be a better culture coming back, you're trying to be better from a safety and health perspective, you're trying to be better at equity, you're trying to be better at health and well-being. If you're not talking and communicating transparently, you're really still going to have a challenge. If you're not really engaging people with what they need, what they want, you're going to build a program that's great for you and not great for the folks you're serving. And you kind of see that time and again, and where we've fallen down on some of these things is building programs and approaches about the way we expect people to do work, or the way we expect people to operate, and not the way that they actually do. So that engagement component, that transparency component, owning up to our faults and being able to learn, that I think is the single biggest thing that can transform organizations of all of these trends. So while every single one's important, if I had to put chips on one that I think could magnify the effects of all of these, that would be the one that I would go with.
Thank you so much, John. And thank you so much for what was an excellent summary of and reflection over this experience that we all have had globally. I'll wrap this up today. I want to thank all of the attendees for taking an hour out of your day. Please give us feedback. If you take a few moments to complete the survey at the end, you'll be prompted to do so. You'll also be sent an email, a follow-up email with a recording of today's webinar, information about receiving continuing education credits, and additional resources. If you haven't already registered, in a couple of weeks, we're holding another webinar on becoming an anti-racist workplace with exceptional speakers. So please register. We can send you that information in the follow-up email. Thank you so much for joining us. And thank you so much, John, for an excellent presentation. I hope everybody has a wonderful day. Take care.